Hello and a warm welcome to all of our Gold viewers who are here with us today. I'm Kristen Schwarz, licensed midwife and one of the MCs here at Gold. And here I am today chatting with Rosa Sorribas. Welcome, Rosa. It's good to have you back here at Gold.
Thank you so much for inviting me. Thank you.
Rosa, you have been with Gold before, and this time you are presenting on the Gold Midwifery Conference of 2025. That is just around the corner. We're very excited to have you here. And your topic is titled Vitamin D, Ensuring Optimal Levels for Healthy Child Development. We want to jump into that in just a moment. I want to talk a little bit about you. You are an IBCLC. You have been in the field for a very long time, but you also have been doing a lot of work on maternal nutrition. So talk a little bit about your background and how this topic of nutrition and vitamin D became of interest to you.
Yes, it was a quite sad story, but with a good ending, a nice ending. I had a cervix cancer, and just few months after I had my second daughter and last daughter. It was about 18 years ago. And after that, I got this cancer, it finished, the treatment, the chemotherapy and everything, and psychotherapy, because that was the worst part of it. I realized that I had huge issues with my nutrition, with my gain weight and with my sudden menopause and all that, those problems. And I started gaining weight and more weight and feeling weak and having several issues. I had Hashimoto's hypothyroidism, and then I started to investigate about vitamin D because I got a book. It was very funny because I had a book which was called Textbook of Human Lactation, Breastfeeding and Human Lactation, and there were so many pages about vitamin D, and I was like, "What? That subject shouldn't be so interesting." And then suddenly, and that very interestingly, that very first moment, there was I think it was about 15 master classes by the University of California TV, which were about vitamin D. And then, I jumped into that pool and I learned a lot about vitamin D. That was about 2007 or something.
Mm-hmm.
It was a very long time ago. And then I started learning more and more about vitamin D. But it was, the beginning of the studies it was very small studies and very weak studies too. These small studies that finally say, you have to study more. You have to learn more about that. More studies are needed, no? I learned about vitamin D because my cancer situation, my weakness situation, and I learned that it was, beyond every field, every health field that I was able to imagine. It was very, very interesting.
Very interesting indeed. I mean, we learned so much now about vitamin D, how it can also influence your mood, your well-being, everything, right? And I feel like now we are at a point where there's still so much more to be researched, right, Rosa? But we know a little bit more, but now there is a lot of different opinions about it, right? What should the levels be? And should we supplement? Shouldn't we supplement? It's really, if I feel like now we're at the point where I personally find that there's a lot of information and I need somebody to help me make sense of it all. And I hope you will help us with that. So talk to me a little bit about what the research says. Where are we in this point of time with our understanding of vitamin D?
Okay, I think that the most difficult issue here is that we are in a very mixed world. I mean, it's something that I will explain in the conference too, but I heard a conference the other day about a woman that was saying that many very pale people, very white people went to Australia where the Aborigines are their skin is very dark. So that's because the sun in Australia is really hard. So that's the normal skin color for somebody that lives in Australia. But if somebody like you or even like me goes to Australia, the sun is going to be really difficult. So for the skin, we'll have a redness and all that. So first of all, there is a huge variety because it's not the same if you go to Australia than if an Aborigine goes to Germany or to Scandinavia. So both of you will have problems. One, because you're going to have too much sun, and the Aborigine person will have too little sun. So it's very, very difficult to make a rule once for all. A size one, a size for everybody, because the diversity is so wide in the atmosphere, the highness where we live. It's not the same if we live next to the beach as I live, or if you live next to the very high in the mountains. So the variety is very wide. So the answer is individuality.
So that is a very individual, and we can't just say, okay, this level is good, that level is bad, and anything in between needs to be. So it is really measured on an individual basis of where the person lives.
The amount of the level that you should have average, because also it changes in summer and winter.
Right.
But the amount of values that you should have is basically agreed about everybody about. There is a number that we'll see in that presentation. But how to get to that number, that's the difficult point.
And that is so true. I have read in many places where they say, okay, the supplementation of vitamin D doesn't really do as much as we thought it was. Can you talk a bit about that?
Yeah, that's really discouraging because I've read so many studies, even for this presentation too, to get an update of the latest researches. And it was really disappointing because when there are some studies that they only supplement 200 or 400 or 600 international units, it's nothing. That's nothing. I mean, it's 10 seconds today in January in Barcelona, and the sun. So that's nothing. It should be much more. And there are some studies that when they use more or they use controlled sun exposure, as I will explain in the presentation, then there is a huge difference in every aspect of life.
Absolutely. Now, this is a midwifery conference, so we, of course, are very interested in the part of, pregnancy and postpartum. And so how much of an influence have vitamin D levels or vitamin D deficiency? What can that do to the pregnant mother, the pregnant person, and to affect the health of the mother, a pregnant person, and the baby? Just briefly give us a little bit of an idea.
Yeah, there is a huge amount of procedures that can go wrong if the vitamin D level is really low. First, just think about calcium. The pregnant mother needs so much calcium that their levels are so high that in a normal, a pregnant woman is also normal, but a non-pregnant person with these high levels would have a severe calcinemia in her body. But she needs so much calcium for herself and especially for the baby, that if her levels of vitamin D are low, she won't have enough calcium, and the baby will take it from her bones. Or the baby will have a lot of issues because the baby won't have enough calcium for the baby. So just in this area that anybody can think about, that's really clear that we need to have a very good vitamin D levels even before pregnancy. And that's what the international recommendations are, to test the mothers even before pregnancy, as soon as we can. If it's before pregnancy, much better. If it's during pregnancy, okay. And if it's after pregnancy, okay, what can we do? But at least do it. Yes, please do it.
Yeah. That's fantastic information, because I don't think that is automatically done in many places, that we check the vitamin D levels before and during and possibly after. And many people maybe have never checked their vitamin D levels. I know this is not. So we as healthcare providers play a huge role also in education, right? Education about vitamin D and how important it is, and how important also the measuring of the levels are. So I'm looking so forward to this presentation because I feel like I just don't know nearly enough, and I want to be a better care provider as well. So I need to learn from you, Rosa, and we all need to learn from you so we can have that knowledge to go out and educate our parents to be, even before they get pregnant. So, right?
Yeah, even you think that if the parents have a good vitamin D level, fertility is better. And well, it's so funny because in Scandinavia, in many places, before having an IVF, they send the family, the couple, to Canary Islands or Greece or somewhere to get a sun to get vitamin D, like it should be from the sun, and then they don't have to pay for this IVF.
Interesting. I did not know that is plays such a huge role also
Yeah.
in fertility. That it's wonderful to know. Well, Rosa, before I let you go, any final wise words for our viewers and what you're hoping that they will take away from your presentation?
I think that they will be impressed about the vitamin D relationship in our body. Every cell in our body has vitamin D receptors. So many people don't think that this is important, but it plays a huge role in our health.
Well, Rosa Sorribas, thank you so very much for being here with me today talking, and I'm looking forward to seeing you again at the Gold Midwifery online conference coming up next month.
I'm very pleased to do. Thank you.
And now some information for our viewers. If you're interested in Rosa's presentation, which I can highly recommend, and you would like to find out also about the other presentations of the conference, please visit goldsmidwifery.com. We have a wonderful keynote presentation to kick off our midwifery conference. That presentation is open access and available to everyone. You can sign up for that presentation and to join us for the conference at goldsmidwifery.com. I hope to see everyone at the conference. See you soon, everyone. Bye-bye.
Bye.